I was in a wreck in July of 2015, and I had a traumatic brain injury. And I did see a neurologist and a physical medicine and rehab physician and a neurosurgeon in Arkansas, but didn't get much relief. I had headaches and lots of neck pain, anxiety, which was brand new for me. I have always been the most laid back, bubbly, happy, and that all changed. So after seeing the physicians and not getting good results, that's how I ended up at Dr. Benson. Well, I've been a nurse for 20 years, and I have always been able to read and comprehend. I could remember patient names, dates, medicines, doctors, spouses' names. I didn't take notes. I didn't have to. I graduated from nursing school with a 4.0. I've never made a B. And I've always excelled in my career, always. After the wreck, and I was off work for 9 months, but when I was able to go back to work, I quickly realized that I was struggling. But the headaches were 2 to 3 days a week, sometimes just crippling for hours. I became withdrawn. I struggled to drive. That was a huge thing for me because I was a home health nurse and 50% of my day was driving. And I would take long routes to avoid traffic because I would get so nervous when somebody would get beside me or in front of me. I had trouble judging distance especially. And then even going to see patients, I didn't have confidence. I could not sit and talk like I could before. I was uneasy. My husband noticed that I just became a totally different person. Just when he came in too close to me, it would make me sick. Or even like laying in bed at night, if we wanted to talk, I had learned myself to compensate, I guess, put one eye down. If I covered one up, then I could look at him and it wouldn't make me sick. But if I looked at him with both eyes, it was going to make me nauseous. So those symptoms were almost disabling for me. I didn't know if I would be able to work. I had a real concern about, can I still be a nurse, number one? Can I be a nurse that doesn't cause harm? Can I be effective? Because I wanted to be productive. I've always been productive. All of those symptoms were crippling. I had real concerns about, would I be able to work for 5 more years? Would I get fired? Could I, I was so unsure of where my future was going to be. After she put those on me, I felt so much better, and it's a strange, you can't really even explain it. It was just instant relief. But when I walked down the hall the first time, without the glasses now, this is before, I started out like going pretty good, and then by the end I was a foot off. And then she had me walk back and do the left to right. And I would, whatever way I was looking, I would drift that way and stop. It was not a steady walk. When I put the glasses on and walked down the hallway, Dr. Debbie said she could hear the clicking of my heels. I was walking so brisk, and it was a straight line right to the picture, turned around quickly with no dizziness, and walked back. Now that I have my glasses, I can drive without anxiety. I can park in parking garages. I can be in closed spaces. I can be in crowds and grocery stores and not feel anxious. And probably the biggest impact has been my work impact, because most of what I do is computer based, so it's a lot of time reading medical records, trying to read the fine print, and I don't lose my place and have to reread the same thing 15 times. It has made me more efficient and more confident. I'm not as nervous or anxious. I don't chew on my fingers anymore, which was a horrible habit I had started just from anxiety. And for someone who's never had anything like that, to feel that way and not know why was rough. So it has made a huge difference. I would want other people to know it's worth the effort. No matter how far you have to drive, no matter how much it costs to get here, it's the single best thing you could do for yourself. We have spent a lot of money with different treatments, injections, needles in my spine, trigger point injections, medications that didn't help, hours on a heating pad, physical therapy, all those things offered very minimal relief. And, by now we're talking tens of thousands of dollars spent for not a whole lot of help versus $1,000 for a pair of glasses. And I've told other people, if there's one place you could spend the money, one thing you could do for yourself was get your eyes checked, because it made the biggest improvement in my quality of life of anything I've done so far.